Hello, my name is Bradley Gronefeld. I'm a senior at Kennesaw State University studying cybersecurity. I'm here to present IoT devices for healthcare. So, a little introduction on IoT. Organizations and people use IoT devices every day for collecting data. Sensors and appliances take this collected data, analyze it, and produce an analysis to the organization or person that is using them. Multiple devices are connected through the network to generate a communication between those devices. And then it also uses automation to collect the data. So IoT devices in the healthcare industry, um, there's over 100 devices within an office. It's more efficient. IoT devices are more efficient than manual labor. They can produce reports and generate data, collect data a lot more efficiently and faster. Some examples of devices are MRI scanners, CAT scanners, monitoring devices. Then they can display precise data to healthcare professionals. So, along with healthcare or IoT devices in healthcare, comes with 3 layers. The first layer is the perception layer. So this includes every sensor that is involved. Some examples are radio frequency identification, infrared and medical sensors, and cameras. They can monitor patients in real time and produce an analysis or a solution in real time. They can discover any abnormalities or changes in the human body while using the monitoring devices. And then they can quickly transmit that gathered data throughout the network to other devices. The next layer is the network layer. So this deals with communication and storage of the collected data. Some examples are Bluetooth and Zigbee. 5G networks have started becoming more prevalent, and this is a huge plus with IoT devices and in terms of networks because it increases the speeds by a ton. And then data is most of the time stored into the cloud. Without this type of storage, it can cause a challenge with healthcare professionals trying to pull up medical histories. Then the last layer is the application layer. So this deals with the interpretation of the data and stores it in an application. AI has become the main application. It uses automation, generates precise analysis of the data. It can determine what is going on and generate a solution in real time. Then it can also provide a list of the best treatments for healthcare professionals to use on patients. So here's a picture of the communication between IoT devices. Let's say, for example, an electrostatic sensor collects data and scans the human body to find out if there's anything wrong. It can connect to the cloud through Bluetooth or Wi-Fi and send it to the cloudlet. And then once it's stored there, it can be opened by any physician that's across the world. And at the bottom there, you can see all the different authentication methods and access controls, identification throughout the different steps, so that only authorized personnel can access data. Some challenges with IoT and healthcare. There are mobile monitoring devices, and this can cause an issue because healthcare professionals have to have a level of trust that the patients will wear these devices while they're home. And if they're not wearing them, then it can cause an error with the data or misread data. And then it can also cause a low quality with the transmission of the data. And that can be from any interference going from the patient's house to the healthcare building. And the next is high costs. With the increased number of devices, it drives the costs up at an increasing rate. The configuration of the IoT devices is very complex, and that can be an issue because it can cause a lot of manpower, and it can use up hours at a time to configure those devices. And then IoT devices also use a lot of power and energy, and that can cause power outages and power leakages and drive up expenses on the building. And then also it can use, because of the large amount of data that is being stored into the cloud, healthcare buildings need the highest they can get as far as storage goes so they can store that data. So this picture is the future costs of IoT starting in 2020 to go into 2030. It doesn't show all the prices, but based on this, in 2021, 83.1 million, and the year 2024, I have to say it's a little over 200 million, and as you can tell, it's going at a pretty high increased rate. So challenges, or some more challenges, any malfunctioning hardware or software, whether that's devices not up to date, that can cause a major issue with scans, monitoring devices, and cause errors with analyzing the data and giving a report on it. This can lead to patients getting misdiagnosed by healthcare professionals. And if a patient's well-being is on the line, it can cause a potential legal lawsuit, which wouldn't be good for the healthcare industry. And then another challenge is data storage. So whether that's data getting misplaced or incorrect scans that are stored accidentally or purposely into a patient's medical history can cause an issue there. Some challenges with cloud storage is every healthcare building has access to the cloud. Making sure every building is properly secured and configured correctly can definitely help with keeping it secure. If there are any vulnerabilities that are left open, then that can lead to attackers exploiting those vulnerabilities, and then could also lead to every single patient's medical history to be accessed. And because it's within the cloud, it's harder to maintain that security with every single building around the world. But making sure that there's little to no vulnerabilities can reduce those chances of getting attacked. So a little bit about security. So it can be complex implementation and configuration for the IoT devices. Any weak or outdated hardware and software can cause issues. Along with the hardware and software applications need to be secured, and then security tools must be lightweight, resource efficient, and can adapt to the device scalability. That is only because traditional security tools like anti-malware scans wouldn't be able to work with IoT devices. Internal security, only authorized employees can access the data. Unauthorized access could lead to tampering data, stealing data. And then some methods for helping with the internal security is two-step authentication, biometric scanners, key cards, and encryption methods for files. So say if someone wanted to access a file, they would need a key in order to open that file, and that will just add an extra layer of security for that cloud storage also. Some key ideas for security: the use of AI. It can be programmed to know the most common attacks within the healthcare industry. It can automatically scan and compare the data collected. It can automatically fix vulnerabilities and generate solutions. And then another key idea is implement zero trust principles. So that certainly helps with basically the ideology of trust no one, in case there's any internal security threats there. Key ideas continued. Encrypt sensitive data during the transmission. Push out regular updates and patches to hardware and software devices. Just making sure there's no vulnerabilities in those. And then implement network segmentation. So basically it divides the network into subnets, and each one of those subnets is its independent network, and this allows the security team to implement policies on each one of those, and also isolates corrupted IoT devices from any IT equipment to prevent the spread of malware. And that is it.